Good evening, everyone, and welcome to our class this evening on healthcare reform and the insurance marketplace. We wanted to thank everyone attending in person and those attending online. Thank you so much for joining us. We have two great speakers that will be answering any questions you have about this topic after their presentation. They would prefer that the questions come after, and so for those online, please submit your questions throughout the presentation through our chat. We will be collecting those to share with the speaker at the end of the event. And for those attending in person, feel free to come and join us at the microphone so that the people online can hear your questions. We do also have a survey for this evening. It's just to gather information on how you felt this class was, and if there's any additional information you'd like us to share in the future, maybe another topic you'd like to learn more about. And we will have a link for that for the people attending online as well. So without further ado, I would like to welcome, both of our speakers, Lois Pace-Bass as well as Brendan Beatree, but we'll be starting with Lois. And again, if you have any questions, please just wait until the end of it. Write those down so you don't forget them, and our presenters will be happy to answer them. Thank you so much for joining us tonight.
Thank you, Sarah. Good evening, everyone. I want to welcome you as well to the foundation, and for those of us joining us online, we welcome you as well. Again, as Sarah mentioned, we are hoping that this class is an informative one for everyone who's gathered for it. My name is Lois Pace-Bass, and I'm the Director of Health Policy for the foundation. I just have a few remarks before our next speaker, Brendan, comes up. But essentially, I just wanted to share some background on how the foundation has supported healthcare reform and what we're trying to do to promote it and make sure everyone is educated about it now that it is officially in place. And also wanted to talk a little bit about what we're doing, what we'll be covering today as part of our talk. Again, as Sarah mentioned, we'll be holding questions until the end. Both Brendan and I will be available to answer those should you have them. But thank you again for joining us this evening. So just to start us off, first of all, we just wanted to reiterate that your fight is our fight. So one of the reasons that the foundation has really gotten behind healthcare reform is not because of the politics of it, it's really because of the policy. What do I mean by that? Well, we know, the data has shown, that people without insurance actually have worse outcomes when it comes to their cancer diagnosis. So we want to be sure people have the best coverage at the most affordable cost so that people aren't going bankrupt because of their cancer, and so that people can receive treatment that's really most effective for them in their cancer journey. So Live Strong and Foundation, through our navigation services, through our policy initiatives, is really committed to making sure that this law rolls out in the most effective way possible for the people whom we serve, namely the people living with or affected by cancer. Secondly, we really wanted to reiterate that today we're really going to be going over essentially the ABCs of healthcare and healthcare insurance and insurance reform. What do I mean by that? Well, the A in the ABC is really the administrative stuff. So when you think about how I apply for this, whether or not I'm eligible, how do I even get enrolled, that's one of the things that Brendan is really going to be focused on as part of his talk. So hopefully that will answer some of the more logistical questions people might have this evening. What's the B in the ABCs? Well, what are my benefits, right? What should I be looking for in terms of coverage? What are my medical needs? So that's also very critical, obviously, for someone faced with a cancer diagnosis in terms of what treatment he or she should really be targeting in terms of a healthcare insurance package. And then finally, with the C, how much does it cost, right? How much coverage can I really afford? What's going to be the price tag? That's also going to be obviously a very essential component of looking for and searching for identifying effective healthcare insurance policies. Finally, just to wrap up, I wanted to make sure everyone was aware of the guide that we have available now online. It's our guide in terms of 5 easy steps for you all to keep in mind as you identify and research your options for healthcare coverage. In that guide, we've tried to compile a lot of the resources available either on healthcare.gov, which is a resource that the government has put out to describe the benefits of healthcare and also help walk people through this process. There's also a lot of information available through some of our partners, including the Patient Advocate Foundation, including a handy booklet on healthcare and you, which Brendan will be presenting on in further detail. There is a cancer insurance checklist that should be helpful in terms of identifying your coverage options. There's a subsidies calculator by Kaiser. So all of these resources we've tried to put in one place so that it's easier for each of you, again, in person or online, to be able to navigate this complicated but hopefully effective rollout of healthcare reform. So without further ado, would like to bring up our next speaker, Brendan Beatry of the Patient Advocate Foundation. He is their Director of External Relations and also a Senior Case Manager with that organization. And we partner very closely with the Patient Advocate Foundation for a lot of what we do in terms of insurance reform and providing coverage for the people whom we serve. So, Brendan, thank you very much.
Great, thank you so much, Lois. And like Lois said, my name is Brendan Beatry. I'm Director of External Relations and a case manager with the Patient Advocate Foundation. And again, thanks to all of you who are attending. We're thrilled here locally in Austin and via live stream. And so Lois and I, as well as my other colleagues here at Livestrong, are strong advocates for cancer survivors and patients with chronic and debilitating conditions. And we have, I'm going to present a brief introduction for those of you unfamiliar with Patient Advocate Foundation. And then we have the most up-to-date information about the new provisions, benefits, and financial incentives of this new wave of healthcare reform. We have some videos for visual relief, and like Lois and Sarah had said, if you have any concerns or doubts or questions, please hold them to the end of the discussion, and Lois and I will get to them, as many of them as we can. Thanks so much. Okay. And without further ado, we'll get going on the slides here. Oh, thank you, Lois. Okay. Very good. So the mission of the foundation at the Patient Advocate Foundation seeks to safeguard patients through effective mediation, assuring access to care, maintenance of employment, and preservation of their financial stability relative to their diagnosis of life-threatening or debilitating conditions. I would say that 4 out of every 5 patients who reach out to us directly or through our long-standing collaboration with Livestrong are cancer patients. Since our inception in 1996, we've helped more than 780,000 patients through sustained case management. And this is kind of a statement of need. This is what has prompted our work and our mission over the last several years. In 2012, we helped over 127,000 patients who had issues around access to care, meaning lack of coverage, inability to afford the overwhelming cost of their medical and pharmaceutical co-payments, and also lack of access to that health care due to transportation issues, practical concerns, and coverage denials. They may have employment challenges, including loss of income, or just as a result of the joblessness kind of state of our economy. They may also have cost of living issues that would force them to forego their treatment because they need to put food on the table, pay their utility bills, and keep a house over their heads. Our case management services is really the key to our mission, and for 17 years we've been providing this case management. Specifically around the following services: negotiation of access to pharmaceutical agents, pre-authorization approvals, and resolutions to coding and billing errors, providing assistance around the Social Security disability process, which is can be very frustrating and very complicated. Also, I've bolded out resolving insurance enrollment issues in both the public and private sectors, and really that's what's going to be kind of the nuts and bolts of what I'm talking about, the insurance marketplace and how best to maximize your benefit, how to position your thoughts on this whole provision, this whole new way of obtaining insurance, and to provide support throughout the process. We also help in expediting appeals for insured patients. This is for denied therapy or denied services of all kinds. We try to negotiate insurance coverage for clinical trials. Assistance with applications to copay or free drug programs, and resolving all kinds of debt crisis relative to the illness. Okay, so just introducing the health insurance marketplace. We're going to get right into it here. Understanding the health insurance marketplace and the state-based exchanges that are already available, technically from yesterday, October 1st. Identifying who is eligible and who will benefit, understanding the enrollment process, understanding plan options, and how to make the best possible decision with regard to your medical needs and history. Define options for those with limited income, and locate resources and additional information. And you'll see the multiple logos on the right of the slide represent the state efforts in various states across the country to establish their own exchange. And part of what we've provided you here at the local audience and as a PDF to the national audience viewing from home is a publication that Lois alluded to called Healthcare Reform in You. At the very end of that publication, you'll see a list of websites. They're state websites that will explain how the marketplace will kind of roll out, will kind of function in that state. Okay, and we'll go into depth a little bit later in the presentation. And with that, I'd like to just tee you up to a video that will kind of get us into this, kind of give you an introduction.
You can do all the things you do with more peace of mind, less worry, and more financial security when you know you've got health insurance. And now, everyone will be able to find health insurance at the Health Insurance Marketplace. It's an online shopping site where you shop for health insurance that fits you with low cost and even zero premium plans for those whose income qualifies. If you or your family are uninsured or just looking for better coverage, you can see your options all in one place with one application. It's a place to compare a wide range of quality health insurance plans, to review them all side by side, and choose the one that's right for you. You'll find the information clear and easy to understand. You'll explore the marketplace at your own pace. You can compare prices and benefits, see an explanation of what a premium is and what a plan will cost you every month before you make a choice. And every plan will cover you with comprehensive benefits, from your visits to the doctor or the hospital, to your prescriptions, to screenings for cancer and other conditions. And no plan can turn you away even if you already have an illness or condition. The Health Insurance Marketplace, part of the healthcare law, opening October 1st. You can learn more right here, right now, and be ready for the new world of health insurance shopping.
Okay, that was just meant to give you an introduction. It was, as you see, a very sophisticated visual cartoon. But we're going to go into the depth here of what we're talking about and give you the most practical understanding so that you can take forward action. If you're uninsured, if you're looking to transition out of the coverage you have now, and of course if you're interested in having some financial incentive for doing so. Okay? So what is the marketplace? It's a new, easier way for individuals to buy health insurance. There are various coverage options or coverage levels to fit your needs. Access to additional financial benefits, like I mentioned, to ensure that it's feasible, that there's that it's affordable, and that you can maintain your coverage. There may be the ability to get lower costs on premiums, and through tax subsidies, and also reduce cost sharing, and we'll go into kind of these definitions a little more in depth. And you're also in the position to get unbiased help and consumer assistance. And also, we'll go over some of the mandates that are part of these new plans, the essential health benefits, and how they differ from plans that had been offered previously. And we'll also go into the application and enrollment process to see that there's consistent formatting and that it's actually quite easy to compare plans, research them, and enroll. Okay, so prior to January 1st of 2014, the following protections were not mandated by individual or commercial insurers. For example, a patient who was diagnosed with a pre-existing condition may not be able to get insurance in the private sector or even in the commercial sector. The new plans are also going to be non-discriminatory with respect to gender and your health status. They're going to have 10 basic essential health benefits that we'll go into, we'll list them a little bit later. And also preventative services to encourage, health and wellness. You also cannot be charged higher premiums due to your health status. There's coverage of routine clinical trial costs, the preventative services like we mentioned, and no more lifetime or annual limits on coverage. So frankly, I've worked with quite a few patients over the 7 or 8 years that I've been doing this as a case manager, and there are some cancers or some conditions that require a very lengthy and a very costly regimen of care. And it's not uncommon for a patient who is insured by his or her employer or through an individual policy to cap out their benefits at $1 million, at $100,000, and essentially that person's left without insurance when that happens. Now, there won't be any more lifetime or annual caps, whether your care costs $100,000 or $5 million. That's no longer in effect. More on the introduction. You'll have the ability to know upfront what your costs and benefits will be before choosing a plan. Again, the formatting of this whole process will allow for apples-to-apples comparisons of these plans, including very clear displays of your premiums, your deductibles, and copays. There's automatic and secure connection to Medicaid or CHIP, which is the Children's Health Insurance Program, if you're eligible. And enrollment should really have started yesterday, October 1st. Now, there may be some kinks in the process, and the website that we'll be referencing later is still in works, but it actually has technically opened for enrollment, and you can go and start shopping. And so how the marketplace works, well, it works much like perhaps searching for airline tickets or Orbitz or Travelocity. There are some differences, but you should be able to create an account. You should be able to apply starting yesterday, October 1st, through March 31st of next year, 2014. You'll pick a plan, and you can do this on your own or through the help of a consumer assister, a navigator. We'll talk about these kinds of types of assistance a little later in the talk. And then you simply enroll, and coverage can begin as soon as January 1st of this coming year. There's one enrollment application that will give you your plan options. We'll talk about what a qualified health plan is. There's a kind of a new term, I believe, in insurance right now. In a tiered structure, you'll know about Medicaid programs that are available in your state and the criteria for those programs, and for the Children's Health Insurance Program. You'll also know financial assistance options and incentives in the form of advanced tax credits to lower premiums. These are credits that you do not have to wait until filing in 2015 to benefit from. They will come in the form of an advanced payment that will go directly to your insurer. We'll talk a bit more about that. And of course, reduce cost sharing and out-of-pocket costs.
Welcome to the draft enrollment process.
Welcome to the draft enrollment process
for the health insurance marketplace on healthcare.gov. The marketplace is where you apply for health insurance coverage starting October 1st. and receive step-by-step instructions on how to find and enroll in a plan that meets your needs and fits your budget. With the application process complete, our fictional single man from Arizona, William Doe, can enroll in a marketplace health plan. In this example, William qualifies to get lower costs on his monthly health plan premiums through a premium tax credit. An Enroll to-Do list helps guide William through the enrollment process and allows him to view tasks he has successfully completed, remaining open tasks, locked task to be completed before he can move on, tasks that can be done in parallel, no particular order. If he were to qualify for Medicaid and/or the Children's Health Insurance Program, these tasks would appear on the same Enroll to-Do list. If not applicable, William would not see these sections. William first reviews and learns the 3 ways that he can use his tax credit. William will then decide how much of the tax credit he'll use each month toward his premium. Use all, use part, use none. William is eligible for $83 each month and chooses to use the full amount towards his monthly premium. The Enroll to-Do list updates the tasks he has successfully completed and shows his next step. Next, William answers a question about his tobacco use. The Enroll to-Do list is updated and shows his next step in the process. Before William selects a plan, an overview of things to know about the health plans and how they are organized are easily explained to help him make an informed choice. William will select a plan from one of 5 categories that are based on how William and the plan expect to share the costs of care. The category William chooses affects how much his premium costs each month and what portion of the bill he'll pay for things like hospital visits or prescriptions. In general, the higher the premium, the lower the out-of-pocket costs. All plans will generally cover the same categories of essential health benefits, like doctor visits and emergency services. William can compare all his insurance options based on price, benefits, quality, and other features that may be important to him. He may select one or more metal-level groupings before viewing plans. William selects to view plans from the bronze category and is then shown a variety of health plans in his area. William can use the filtering options on the plan results page to help narrow down his plan search. He selects 3 plans to compare. Consumers can select up to 12 plans to be compared. However, only 3 will display at a time side by side. The Plan Compare page displays his plan selection side by side. He can compare the costs and easily see what his monthly premium, deductible, and other out-of-pocket costs will be before he enrolls in a plan. To view more benefits and related costs, including coverage examples to illustrate costs associated with managing diabetes, he can scroll down the page and use the plus-minus signs to expand or close each section. He can click on Details to go to View a Specific Plan Details page. William can save plans to his account if he wants to continue shopping or review the information in more detail later. He can also print, download, or email the plan details information or click Enroll to enroll in a plan. William enrolls in the plan that meets his needs and fits his budget. The Enroll to-Do list shows the successful completion of all enrollment steps. William selects Pay Online and is redirected to the plan's website, where he can pay online or work with the plan's customer service to make arrangements to pay his first month's premium.
Okay, so it's important to note that as you saw, the costs are rather transparent, which is a good thing. You also need to be able to, well, you can pace yourself through the process. There are a number of tasks that you'll have to complete. If it becomes a bit overwhelming or frustrating, or you have doubts through the process, you can always kind of pace yourself. And know also that your coverage actually won't become effective until you make that first premium payment. That's an important part of it. Okay? And so there's essentially one portal to go through, which is meant to be simplified. It's an income verification process. So through this one application in the state in which you reside, be it Texas or outside the state, they're going to verify your eligibility for the state Medicaid, They're also going to determine if you were to opt into a marketplace plan, if you'd be eligible for a subsidy, and what the amount of the subsidy would be, or if you're not eligible for one. Then you're going to select the benefit level, and those are tiered by metals. It's platinum, gold, the silver is not too visible, I'm sorry about that, and bronze, and you'll see the level of coverage underneath each one of them. And so those are the benefit levels. Now your policies are still going to be issued and carried by well-known carriers such as Blue Cross Blue Shield, Aetna, Cigna, United Healthcare, Humana, etc. And then your enrollment's completed. So we want to stress that, that if you're interested in opting into a marketplace plan, that you do so by December 15th of this year. And that ensures that you have effective coverage on January 1st. So who can use the marketplace? All kinds of people. Individuals and families who are currently uninsured, those that would be eligible for Medicaid in their state due to the new sort of rules around that each state has opted into, and Medicaid expansion. And those that have been previously declined insurance coverage due to a pre-existing condition. Those also with a current pre-existing condition insurance plan, which was a provision that was available in these last 2 years, but which will phase out with the sort of emergence of the marketplace. And those folks with those pre-existing condition plans will have to transition into the marketplace by December 7th. I think that appears in a further slide, just to keep an eye on that. Those that currently have non-comprehensive or limited coverage, now that could be catastrophic insurance for those of you who are age 30 or above. It could be a limited plan or what they call a mini plan. Those are very feasible, they're very affordable, and because they're very affordable, they're very attractive. You may not have had health concerns that would warrant a comprehensive plan previously, which may have prompted you to look into, well, a more affordable policy. And those looking to switch from their current coverage to a marketplace product or compare and research options. So I can think of a good example. That might be someone who is a sole proprietor or a self-employed person who purchased insurance in the individual market at quite a heavy price, but now with the marketplace would be eligible for a tax subsidy, in which case I might urge them to go into the marketplace. And it's important to know that the marketplace is not for those who are enrolled in Medicare or are Medicare eligible. And those could be folks who are 65 and above, or those who are long-term disabled. Okay, and so marketplace eligibility guidelines require that you live in the service area of the marketplace during the entire coverage period you seek. They also require that you be a U.S. citizen, a legal resident, or lawfully present. And that you also not be incarcerated, with the exception that if you are incarcerated pending disposition of charges, then that could be kind of an exception. And like we mentioned, seniors or folks who are long-term disabled do not need to kind of factor in the marketplace. They don't need to meddle with it. Now, it's important that if you're Medicare eligible and you'd like to claim your benefits, you may have to pay a penalty for Medicare Part A, B, and D if you choose to sign up later. It's important. You also would not be eligible for lower costs to help pay your premiums or cost sharing. And if you are in a marketplace plan, when you become eligible for Medicare, you do lose any tax credit that you are benefiting from. It's also important that right now it is illegal for brokers and agents in any setting, whether it be a storefront or a grocery store or a farmer's market or wherever, to sell a marketplace plan to a Medicare eligible individual. And that may come up in certain rare occasions, so you want to be aware of that. If you have an aunt or a daughter or a mother, or you want to make sure that that person's Medicare eligible. You want to make sure that there aren't agents or brokers that are trying to sell them on a marketplace plan. Okay, so we're going to tee up another video, and this will go through, I believe, the application process. And here we go.
Welcome to the sample application for the Health Insurance Marketplace on healthcare.gov. Here, individuals and families can explore health coverage options and opportunities to get lower costs on monthly premiums. Individuals can submit applications starting October 1st when open enrollment begins. The application features dynamic messaging to answer consumer questions, to guide them through the process, and to encourage them to apply. This online dynamic tool will enable applicants to complete one application for enrollment in a qualified private health plan, the Children's Health Insurance Program, and Medicaid, and determine if you're eligible for lower costs on your monthly premiums. With integrated electronic verification, applicants can get health coverage and be matched with programs to help make that coverage more affordable. To demonstrate, let's look at the application process for a fictional single man from Arizona, William Doe, who is looking for health coverage just for himself. William will fill out the application online to apply for coverage. Before beginning the online application, William will create a user account. Then, from his account, he will access the application. The Privacy and Use of Your Information page lets William know how the information he enters will be used, and that data from other sources will be accessed to verify his information. Integrated systems will check his eligibility by retrieving information from other federal agencies to verify responses and provide real-time answers. Personal health data is not stored. On this contact information page, William answers a few questions about his home and mailing address, his contact phone numbers, the language he prefers to speak and read, and how he wants to be contacted by the marketplace. This information is not shared with any external party. William has the option of naming someone as his trusted representative. This person would have permission to talk to the marketplace about William's application and sign William's application on his behalf. William declines this option. William is only interested in getting health coverage through the marketplace for himself. So on the "Who are you applying for health coverage for?" question, he selects William Doe. William checks yes to see if he is eligible for help paying for health coverage. William isn't adding any family members to his application. If he changes his mind, he can add additional family or household by clicking Add Another Person. In the next section, Family and Household, applicants can apply to get help with health insurance costs. In the William Doe Personal Information screen, William enters his personal information. Then he completes a series of questions about his household and how he files taxes. Here, William has the option of providing his race and ethnicity. William needs to answer a few additional questions that could determine whether or not he qualifies for additional assistance or certain protections. Here on the Family and Household Summary screen, William has a chance to review his answers and make any changes. Eligibility for financial assistance or for Medicaid or CHIP is based on income and household size. On the Income screen, William finds out what documents he needs to answer the next set of questions about his income. Income information can be complex. This part of the Marketplace application incorporates electronic verification to help applicants easily answer these questions as accurately as possible. When federal income tax data is available for a household member, and the confirmed income amount is high enough so that no family members applying for health coverage would be eligible for Medicaid or CHIP, this section is shortened to two simple questions. William enters his expected annual income of $40,150 in 2014. We ask one question about William's monthly income to see if he is eligible for Medicaid in the current month. Here, we use the figure $1,250 because this amount would make William eligible for Medicaid. William's monthly income will be more than $1,250 per month, so he is not eligible for Medicaid. Once we know household size and income, the system can determine which affordability program each applicant may qualify for. To see if William is eligible for lower costs on his monthly health plan premiums, we'll need to know whether William gets or could get affordable health coverage through his job. To determine this, we ask some questions about William's employer. In this section, William will be able to review everything he's entered and have a final chance to go back and make changes. On the Review Application page, William can review and print out all the information for his records. William then reads and agrees to a few additional statements. To get his eligibility results, when he's ready, William must review and agree to the list of statements on the Sign and Submit page. The statements are based on programs he may be eligible for. He can then sign his application electronically and officially submit it to the marketplace. On the application results page, William gets a list of programs for which he qualifies, and we let him know the next steps. Applicants can print the results page and have their eligibility determination saved to their electronic account. In this example, William qualifies for a tax credit, a way to get lower costs on his monthly health plan premiums. By clicking on links on this page, William can also get more information such as how his eligibilities were determined and how to file an appeal. That's a quick look at the application process. With the application process complete, William can now enroll in a Marketplace health plan and apply his tax credit right away.
Okay, so the application process is actually online and it's available to you. Now, there is a paper application that's not quite available yet. That should be available in short time if you're more comfortable with that process. Available in English and Spanish. And it's very dynamic. It's very simplified, as you can see. And the video you just watched was really it's for those states who have chosen to allow the federal government to run their state exchange. Okay, the states that will eventually create and run their own exchanges will be available. In fact, all of the logos that we showed earlier in the presentation and the websites that you'll see at the end of the publication that we gave you out, you can actually have a list of them there. And so that single application, to reiterate, will verify your income, your eligibility for financial assistance, and also for the state Medicaid program. Okay, and I think I mentioned this a bit earlier, but this is the when is my health coverage going to be effective? If you are able to enroll during the initial open enrollment period on or before December 15th, your coverage will be effective on January 1. If you're able to enroll during the first or the second half of the open enrollment period, your coverage will be effective the first day of the following month, and so on and so forth. There are some exceptions and special situations that apply. Okay, so we talked a bit earlier about qualified health plans, and to define those are offered by an insurer that is licensed by the state and in good standing. They must cover all of the essential health benefits, and we'll go into that shortly. It has to be offered by an issuer that offers at least one plan at the silver level and one plan at the gold level. We talked about the metal plans earlier in the talk. It's offered by an issuer that agrees to charge the same premium rate, whether offered directly through the marketplace or outside the marketplace. And of course, there are no lifetime or annual limits on those coverages. And so here are the essential health benefits. There are 10 of them, and they're all mandated for any plan that you would find in the marketplace or in the individual market. They're ambulatory patient services, that's all of your outpatient visits, lab work, et cetera. Emergency services, hospitalization, maternity and newborn care, mental health and substance abuse disorder services, including behavioral health, which is a major change, a major addition to these mandated benefits. Of course, prescription drugs, rehabilitative and habilitative services. And I underline that word because it's a new term. Of course, we may know what a rehabilitative service is to help someone recover or convalesce from a condition, but habilitative really equips you or allows you to be fit and well so that you may not have a relapse or a rehospitalization from your condition. And of course, laboratory services, preventive and wellness services, and chronic disease management, and pediatric services. And again, sorry, the slide's a bit off kilter, but you see the plan levels for the bronze, the silver, the gold, and the platinum plans. The silver is what they would call a benchmark plan. It's your basic plan that would allow you to, the tax subsidies and credits. You have to kind of opt into that level of coverage in order to get those incentives. And then the percentages on the right are what the beneficiary or the individual would have to pay. And again, they're issued by your common carriers to the right. And so if we talk about financial help, of course we mentioned tax credits a number of times. These are to lower the premiums that qualified individuals pay. You can ask for an advance credit available immediately, or for that credit to be deferred to when you actually declare your taxes in the following year. There's reduced cost sharing, which refers to that percentage on the right, the 10, 20, 30, and 40%. And we'll talk about what the exact criteria to receive that cost sharing is, and I think the next slide. And only available through the marketplace for those that qualify. Okay, so for the tax credit, you need to have the household needs to be between 100% and 400% of the federal poverty level, which is roughly $23,550 for a family of one, for a family of four at the 100% level to $94,000. And you have to obtain a plan that's at least at the silver level or above. You must be ineligible for governmental coverage such as Medicaid, employer-sponsored insurance through your job, or certain other minimum coverage. The benefit can be given to you immediately or as a credit sent directly to your insurer. And so this kind of just reiterates about the reduced cost sharing. This has a slightly lower income threshold at 250%. So if you have a family of four and your gross income is below $58,875, then you would be eligible for partial cost sharing for that percentage that the insurer requires you to pay. And you have to be receiving the premium tax credit as well, and again enrolled in at least a silver level plan. Now, there are circumstances by which patients can enroll outside of the typical enrollment period, which is October 1st through March 31st of next year. And these are qualifying events. It could be a marriage, a divorce, a gain or loss of a dependent, gaining lawful presence in the United States, loss of other insurance coverage from an employer perhaps that has gone bankrupt. You can become eligible for subsidies due to change in income, relocation resulting in a new or different qualified plan selection, so relocation out of your region or your state, and enrollment errors that happen and that will most likely happen in the marketplace, and then exceptional circumstances. So starting in 2014, this is all part of the minimum coverage mandate. You may have heard through the grapevine that there will be a fee, a penalty, if you don't obtain and maintain a certain level of coverage through your employer, through Medicare, through Medicaid, through CHIP, which is the Children's Health Insurance Program, through TRICARE, which is a veteran's benefit or an actual health plan, certain VA coverage, or an individual policy. And that fee will become incrementally larger and will apply to your tax returns in subsequent years. Now, some people may qualify for an exemption. For example, those folks who don't earn enough to be required to file taxes. There are also exemptions around people who have certain religious beliefs that would not, that are kind of adverse to health insurance. And also those folks who are not lawfully present here in the States. And that kind of gives you numbers on the penalty. So in 2014, they're not required to charge more than 1% of your household income, and that would be when you declare your taxes and on down the list. So for patients and their families, choosing the right coverage to meet their needs is critical. And I guess in my experience, and it is the belief of Patient Advocate Foundation that, or the suspicion I may say, that hospitals and hospital systems may adjust their policies with respect to the uninsured as a result of this new provision of healthcare reform. It's important to know that if you're a healthcare provider or a patient or a survivor or even a healthy individual, it's important to know that as a result of the marketplace and this kind of open option, that hospitals may or may not adjust their charity care policies to provide free care or reduced cost care to the uninsured. So it's a really important kind of thing just to keep in the back of your mind. People have different limits on what or roles, we could say. Some of them simply educate and do outreach in their community, and others actually will prepare the enrollment application and help you follow through the process and enroll. Now, Patient Advocate Foundation has not been designated as one or either of those, as a navigator or as what you might find as a certified application counselor. So we're here to do the education and the enrollment for you, either here locally in Austin or nationally in your area. We're not constrained by some of the limits that are placed on those who are granted this designation, if that makes sense. So we're going to remain that go-to person to help you with not only educating you, but helping you apply and eventually enroll. You can also go to an agent or a broker. They're by law not to have a vested interest or gain any commission out of selling you a marketplace plan. They're simply there to help you understand the process and enroll. The healthcare.gov and state marketplace websites, and then of course insureUstoday.org from Patient Advocate Foundation. I believe everyone got an insert today locally, and those folks viewing from home, there's a PDF for you as well, and that kind of goes over the website. Okay, I just wanted to talk briefly about the Small Business Health Options Program. Now, this is for small employers as well as the employees of small businesses. Beginning in 2014, small businesses will have more choice and control over their spending. They'll be incentivized to offering qualified health plans to their eligible employees. They simply will not be mandated to do so, but there will be many state-run and federally run SHOP programs that will benefit not only small employers like the diner down the street or a retail storefront or an auto body shop, for example. So there'll be incentives starting 2014, and they'll actually be mandated to provide these options in 2015. And the process is much like it would be for an individual. You create an account as an employer, you would apply pick a plan and enroll. And as it stands now, the small employers with fewer than 100 full-time employees are able to qualify. And in 2014, 2015, that number will drop to 50 full-time employees. And the employer will access the shop where its principal business office is located or through its employees' primary work sites. And this is available, well, in fact, for sole proprietors, for folks who are self-employed on their own, they can also choose to go through the marketplace as an individual. And so to recap, so we can get to some questions, the marketplace is a new way to find and buy health insurance. Qualified individuals and employers can shop for their health insurance that fits their budget and that's feasible for them. The states will have the flexibility to establish their own marketplace or default to a federal standard and allow the federal government to operate it. Individuals and families may be eligible for lower costs on their monthly premiums, and there is assistance available through navigators and certified application counselors and nonprofits such as our own to help you. So as just another recap, you have choices. You can shop and kind of pace yourself through the process, understand what you might anticipate as your medical need and what would be the most adequate plan to opt into. Purchase from the marketplace is not required. You can go through an employer, you can go through the individual market, you can qualify for Medicaid, you might become eligible for Medicare, you might have veterans benefits, etc. But the marketplace is the only place, obviously, to benefit from the tax credits and the cost sharing reductions. And so you can go to healthcare.gov or marketplace.cms.gov to apply, enroll, and get coverage. Or you can kind of follow the updates on Twitter, Facebook, YouTube, and the health insurance blog. And so everyone who has attended here locally got a copy of the Healthcare Reform in You. It's really a nice booklet. It's very simplified for you, just like this presentation was. And those of you at home can go to patientadvocate.org/marketplace guide and have access to it there. And likewise, you can also go to insureUsToday.org. This website is designed to add clarity to the healthcare reform law and give you a year-by-year understanding of the implementation of the law. It's quite a user-friendly website. And in addition, I did also want to mention that Patient Advocate Foundation has 3 resource directories, and those are for the underinsured, to the left of the screen here, for the uninsured, and then financial resources that you can access in your area. These resource directories are very up to date. We keep them current, and they may be able to help you with regard to some of the out-of-pocket costs that are unmanageable should you choose to opt into one of those tiered plans. So they're there for you, as well as our Facebook page and our smartphone app. So utilize those as you need them. And that's it. So if you're a cancer survivor or someone who's chronically ill, Patient Advocate Foundation is here to help. And you can, by all means, contact us at our national office on the right in Hampton, Virginia. And if you're a cancer survivor or current patient struggling with the cost of your treatment or an insurance issue of any kind, feel free to reach us here in Austin, Texas at the Livestrong Cancer Navigation Center. So we're all set. I just wanted to kind of tee you up to some questions. Sarah, can we open everything up for questions?
Yes, we have plenty of questions online, but I want to give an opportunity for the people in person to ask a question if they have any. Yeah. You'll have a microphone for those online.
And I'll have Lois Pace-Bass join me again, if she would. Okay.
Thank you very much for the information. I would like to ask the question, just kind of like posing a scenario. So say that I have insurance through my employer, but the benefits are not looking as great as the ones in the marketplace. One, would I be eligible to participate in the marketplace? And if not, do you know if the rest of us who are on these health insurances that are not part of the marketplace, are our insurances going to be able to cover those 10 basic benefits that are stated by law? Is that going to happen, or what's going to happen with that?
Well,
Thank you.
to answer that question, they are mandated to cover those essential health benefits. Now, the only exception to that would be what they call, and I didn't go into this, but what they call a grandfathered plan. And these are plans that are exempt from certain mandates. Now, if you have employer coverage, and there's an easy way to ask your agent or HR department, for example, if this is a grandfathered plan. Now, if you have employer-sponsored coverage and it doesn't meet the minimum requirements for coverage or excludes a certain essential health benefit, then that would allow you to, or enable you to get into the marketplace. Okay. But essentially, if it's a comprehensive employer-based plan, then I believe that at this point in time that you're not allowed into the marketplace, as long as it meets those minimum criteria. So.
This is one of the questions from our online viewers.
Great.
So what happens if you are on COBRA, and what happens when your COBRA ends?
Well, so the question was, what happens if you're on COBRA, which is a continuation of an employer-sponsored plan, and when that coverage ends? Well, that's really one of the qualifying events. So you may know that COBRA is a kind of a finite extension. It only typically lasts 18 months. Unless you're eligible for an 11-month extension based on your Social Security disability approval. But when that 18 months ends, if now you all of a sudden are left without an option, that's a qualifying event for you to jump into the marketplace. And you can do that immediately. You don't have to wait for the typical open enrollment period.
Then another one from an online user. What happens if I enroll in a plan and Congress decides to defund the entire thing?
Good question. So the question was, what happens if I enroll in a plan and Congress decides to cancel or defund the whole project? And I think Lois will answer that for
I
you.
have the hard questions. The answer is obviously we don't know. We are continuing as though this is going to be in place and will continue to be the case until everyone gets covered, as they should be, by the law. Obviously at the foundation, we're going to push for full funding of healthcare reform and its implementation. But if anyone here has a crystal ball, let us know. But we are, in seriousness, we are hopeful that Congress will sort of resolve its current impasse. And I think what we have seen in the media, in the, in people's attendance at this class, in person and online, is that this is very much a need for people living with cancer and otherwise. And so I think that the demand will speak for itself. I hope that answers the question.
Thanks, Lois.
Good evening. I've learned since I've been here today that I've been on Social Security disability for almost 2 years. It'll be 2 years in January, so I'm not going to be eligible for the plan. So this is slightly off topic, but I'm still very interested, and I drove all the way over here. So when I have a private policy that's working very well for me, do I have to give that up when I become eligible for Social Security?
Absolutely not. You mean for Medicare?
Medicare,
Or,
yes.
sure.
That's right, yeah.
No, that private policy that you have, and that's a great question. If you have an individual policy, or if you have a benefit that's part of your pension package, or let's say, and you become eligible for Medicare, you can remain on that private policy as a secondary, or either as a primary. Medicare and your other policy will coordinate their benefits. So the answer is you do not have to abandon or cancel that policy.
If I did decide to go to the Medicare, if I'm doing it on Social Security disability, am I still eligible for the supplements and the drug policies and things the same as someone who is age appropriate for Medicare?
Absolutely. You're eligible for what they would call a Medigap supplement and the prescription drug benefits and all of that.
Anyone has to sell me that, or do I have to? Only certain people, since I have a pre-existing condition?
Well, no, if you're becoming Medicare eligible for the first time, there are guaranteed issue plans in each state. Not every insurance carrier will offer them, but there are guaranteed policies that are designed for folks with pre-existing conditions.
Okay, and are they similar price to the others, or is
that requires some research. Of course, Patient Advocate Foundation is here to help you do the cost comparing. And
I'll call you next week.
Okay,
right.
Great, thank you.
So there are a few questions online surrounding income and how it's put in within the healthcare exchange. So the first one was, when asked for income, do we list the gross or net income?
It's gross income. Mm-hmm. So when you are applying and enrolling in the marketplace and they're doing your financial eligibility, it's always going to be gross income from all sources in the household.
And then we had another online user that asked, what income do I put if I am currently on paid family leave?
Well, paid family leave refers both to a federal protection called FMLA. It's the actual law that allows you to take leave from work and return to work and essentially not lose your job because of that leave. There's also another benefit called short-term disability that goes tandem with FMLA. And so you would simply report the amount that you receive on a monthly basis times 12 to make it an annual amount. Mm-hmm.
And then the last one in regards to income was, what would you put if you are currently unemployed?
Well, you would put 0 unless you're receiving unemployment. So there are probably through the application process, if you're unemployed or if you have no income at all, there are ways to show proof of that lack of income, either through the last check stub that you may have received, or there may be ways to do that, easy ways.
I've got an income-related question in the enrollment process. Does the fact that an individual pays child support, how is that factored in?
Well, that's an interesting question. That I'm glad you asked it. I would have to research that because I do not believe that child support that you pay in or that you pay out could be exempted from the income calculation. That's the way it works with Medicaid. That's the way it works for other public benefits such as food stamps, et cetera. That money that you've paid out to child support is not subtracted or factored into the calculation. But I need to research that. I'll make a note of that.
I have a few questions. My first about income. What is the actual math to determine what my percentage below the poverty level is? Because they say 250%, 400%. How do I calculate that versus my income?
Well, okay, so how would you calculate where you fit in the federal poverty level? There are tables that are available. I didn't make them available on the slides, but you can determine whether you fall under the 250% threshold or whether you're between 100 and 400%. If you one easy way to do it is to Google federal poverty level table, and you'll find it easy.
Another way to do it is we actually included a link to that resource in our resource guide. That's available online, and I believe we have some copies here as well. And so that should take you directly to that wonderfully designed IRS page.
Okay. And then other questions I had. Can I qualify for a subsidy to use against my current employer provided plan?
No. The only way you can qualify for a subsidy is if you enter the marketplace.
So if my current provider plan is above 9.5% of my income, then I qualify to enter the market. I mean, from my understanding, I qualify to enter the marketplace, correct?
Well, if chances are you would have minimum coverage through your employer-sponsored plan, and that would
My current plan is 22% of my income.
Okay.
And that doesn't include all the money I've spent on my cancer diagnosis this year.
Okay.
So that's what I'm concerned about moving forward is I was left with $3,000 spending money this year if I pay my bills.
Right, I understand your point.
And that's just the reality for those of us when we're diagnosed with cancer is like, how is this going to benefit us? And like if I were to choose a platinum plan, which with a cancer diagnosis is the most sensible, is it still gonna, how cheap is it going to be or how expensive is it going to be for us to make that decision?
Well, I'd have to give you a more definitive answer. Things are kind of in flux at the moment, but they're definitely not discriminating on your pre-existing condition and age and gender. So chances are you would be eligible for a more reasonable plan even at that platinum level.
Okay.
But I definitely like to look into that a bit further.
Okay, thank you.
Okay.
We had another question come from online, some questions, additional questions around income. So if someone maybe is self-employed and has a fluctuating income year by year, does that mean their premiums change every year? How should they complete the application or update the application so that it reflects either their income going up or going down on an annual or even a monthly basis?
Sure. So one of the qualifying events that we had listed earlier is if you experience a drastic drop in income or if it fluctuates, as Lois is mentioning, then that would allow you to be reconsidered for the subsidy or for some of these incentives. So that can happen throughout the year. And it's going to be interesting how many times a year that they allow that review, that re-review to take place or that reconsideration. But it's certainly a qualifying event. Let's say you were self-employed one year and did quite well, and then the next year the economy, really suffered a decline. Then you can actually submit for reconsideration and perhaps get a subsidy that way.
Yeah, I was lucky enough to have a good year last year, and I don't know what's coming up, but so that's good information to have. If I suspect based on last year's income that I don't qualify for a subsidy, can I go directly to an insurance company? Are they required, like Blue Cross Blue Shield, without going through the marketplace, and still are required to not deny me because of my cancer diagnosis?
Absolutely, right. And if you were to go to Blue Cross Blue Shield or any insurer through the individual sector, they're absolutely not able to discriminate on the basis of your pre-existing condition. However, if that's part of the individual sector and not the marketplace, then you're not eligible for the subsidy, given the decline in income you may have experienced over the year.
But if it's based on my gross income from my tax return last year, I have to report a certain amount, which looks great, but doesn't take into consideration all the expenses.
Sure.
So I just wonder if there's a benefit going through the marketplace for me if I don't suspect based on that gross income.
There's absolutely a benefit, and you might be connected with Blue Cross Blue Shield, but through the marketplace and not through the existing individual sector. I know that it's kind of complicated to consider it, but you definitely want to go through the marketplace to take advantage of the subsidies, and you'll be able to remain with Blue Cross Blue Shield and their given network in your area, or to go with a different insurer. But it definitely behooves you not to choose and opt into the marketplace.
Okay, thank you.
Yeah.
I was wondering if those that have PCIP have to go ahead and apply online just like everybody else? Or is there like some kind of, like you were mentioning, there was a transition period? Is there any difference for those who have PCIP versus those?
Well,
applying?
I don't believe there's any difference.
Okay.
The only difference is the date by which you need to enroll in the marketplace. So you would ideally go to healthcare.gov as a PCIP enrolled individual by December 7th and complete the enrollment process by that day so that you don't have a lapse or a gap in coverage.
Okay. And my other question was, is there a minimum amount of time that if once you decide you enroll and you apply and everything, is it like a whole year you have to pay for coverage, or if you decide that it's not right for you, can you, stop or look for something else? You know what I mean?
Well, I believe that I'm not going to say this with certainty because you may opt into, let's say, a silver level plan in the state, for example, Texas, and realize that you'd like to up your coverage or decrease it based on your needs. You definitely want to be aware that if you cancel your coverage altogether, you may incur a partial penalty, for being uninsured for any part of that year.
Right.
But you may also be able to, at any time in the year, up your coverage or decrease it.
Okay.
If that makes sense.
Yeah.
Okay.
So I was hoping that we could talk a little bit, Brendan, about the actual benefits and certain types of coverage and how that can be utilized. One question came in about fertility specifically, and I know for cancer survivors, they're very important pieces of the legislation that are important for them, such as coverage for clinical trials and other types of coverage. Can you talk about the types of things that they should be looking for and how they should be asking for these types of benefits as part of shopping the marketplace?
Okay. Well, it's important to understand that with the marketplace plans, the only mandated benefits are those 10 essential ones. Now, unfortunately, fertility preservation, if we're going to speak about that specifically, is not a mandated benefit in every state. Now, there's a certain level of fertility preservation that's mandated in, I believe, 15 states across the country, and those can be researched. But you just want to look basically at your plan description, like we've mentioned earlier, to know what your limitations are, what your exclusions are, and know that if you're pursuing a service such as fertility preservation or something the insurer may think is a bit more cosmetic or experimental for your condition, then those denials that result from your insurer, they can be appealed. But the easy answer is to just, you need to kind of inspect your insurance plan and know what's covered and what's not. And again, those 10 essential benefits cannot be not covered. They have to be, they're mandated, and that's really the short answer to it. So, but there are some services, and I know from experience that the fertility preservation is a very needed benefit, and there's a lot of effort out there to make it, across the board as a mandate. But to this day, it depends on the state in which you reside, and largely on the specific plan you have.
One question come in from a cancer survivor who's been prescribed some alternative medications, and they were wondering if that could fall under the prescription costs that are a part of the 10 essential components of these healthcare exchanges.
Well, it may be a prescription drug, but it's not necessarily. The insurer can still deny what they would consider an experimental drug or agent or therapy. Because it falls outside of the standard of care for your illness. That can still happen, but of course those denials can be appealed. So even though the experimental drug is a prescription drug, the one case where that may be different if it's part of a clinical trial. The insurer is required to cover the routine costs, the baseline testing, and all of that that's wrapped up in the trial. I hope that makes sense. So.
Yeah. What if it's something that's more like CAM, like complementary and alternative medicine, something like Eastern medicine or acupuncture?
Mm-hmm. Well, I would answer that in the same way. It may not be a covered benefit. It may require an argument as to its medical necessity. Otherwise, an insurer can still maintain that it's not the standard of care. But those sorts of coverage issues and denials can always be appealed with the help of us, or with the help of a nurse, or someone who's from the medical office.
And we had one more from a cancer survivor who sees an oncologist at the Mayo Clinic but lives in another state. She asked if she could still go to those doctors at the Mayo Clinic.
Well, now that's an interesting question, because these tiered medical plans are going to be issued by the same sort of insurers that exist now: Blue Cross Blue Shield, United Healthcare, Aetna, Cigna, WellPoint, etc. The question would be, is she changing her policy? Is she going to transition into the marketplace? At which point she'll need to know what her network providers are. So it may require a closer look at her plan to know if she can change providers, or to see how broad her provider network is.
So in that same vein, we had another online user that asked, is there a place where one can check when enrolling to see which oncology providers are in network?
I believe so. I know that if you're opting into, for example, the silver plan offered by Blue Cross Blue Shield in the state of Texas, where we're here residing, you can actually go online and their website will tell you what participating providers they have, whether they be a specialist or a general practitioner, a pharmacy, a durable medical equipment supplier. I believe you can actually do that.
Any other questions?
Are there grant programs available for cancer survivors that already have insurance but have to pay a large copay for an upcoming surgery, for instance?
There are, and they're by and large they're diagnosis specific or medication specific. They're difficult to come by. The funding is well, there's more demand, of course, for the supply on the funding. But that's something that a case manager at Patient Advocate Foundation or other nonprofits that we collaborate and have relationships with can tell you, can kind of assess and search out for you. But there are funds that exist for cancer survivors who are insured, who can't manage the costs of their therapy.
So such a person could contact Livestrong Navigation Services?
Absolutely. Mm-hmm.
Wonderful. Well, I want to thank everyone for joining us tonight, and how about a round of applause for our presenters? Thank you so much for sharing all your knowledge on this new endeavor that we all have starting yesterday in figuring out the insurance marketplace. I understand it much better now. Thank you.
Thanks so much, Sarah. Thanks, Lois.
Remember that you might not have thought of any questions. We might not have gotten to all the questions online. So sorry about that. But please remember that you can reach out to Livestrong and talk to one of our navigators. Our toll-free number is 855-220-7777. So don't hesitate to reach out. Also, as a reminder, we do have that survey. The way that we're able to provide these educational opportunities is based on the topics that you guys are interested in and knowing what you'd like to learn more about. So if you don't mind taking that moment to complete the survey, for those in person, you should have them in your hand, and online we'll be sharing that link again. Thank you again so much for joining us this evening.